Hey besties, welcome back to another episode of the Nurse Aspect where we assess and evaluate. I'm your host, Nurse Becca, and today we have in flight Nurse Dustin. How are you?
Good. How about you?
I'm good. Thank you
Good.
so
Thanks
much
for having
for
me on today.
joining. No problem. Thank you so much
Yeah,
for joining.
for sure.
So we're gonna get right into it. Tell me what inspired you to become a nurse.
Well, I did internet marketing for 5 years, and really where it all started, I was sitting in a meeting. I had a couple other people in the room. We were trying to come up with some different ideas, and I just had this thought that hit me hard that said my brain does not work like everybody else in the room. And it was kind of a little bit tough for me, but from that point, I was like, I got to find something else to do because this is not for me. So I started just kind of exploring, trying to find different things. And I took an anatomy and physiology course that had a cadaver lab. And that drew me in immediately. Like hands-on, inside the body, learning how everything worked. It just really was something that was special. And I thought, yeah, medicine's kind of where I want to go. And I was taking other courses, trying to explore all the avenues of what I wanted to do. But that one sealed the deal. So it was a little bit later. I moved to New York and started working as a patient care associate, and got to see really what nurses do, and also what doctors do. But I fell in love with nursing. Felt like that's where I needed to be.
Wow. It's crazy that taking an anatomy course with cadavers, which is so not common at all.
Yeah,
That's what led you into it. That's pretty cool.
yeah.
After you became a nurse, where did you start? What
I
career?
started in the ED. So it kind of started. I worked as a float patient care associate, so I got to see all aspects of the hospital.
Mhm.
And I fell in love with the ED. And so through nursing school, I was working and knew that I wanted to work there coming out of nursing school. So I got into one of the nursing fellowships, and it was a year-long program in the ED, and we had a bunch of training. We'd rotate through other units, and we just loved the ED. So that's kind of how I got my start in the ED, was through that program.
And then how did you end up becoming a flight nurse?
Ooh, so that one was kind of fun. My first year of nursing school, I had to take, or one of our courses, I had to do a project where I'd learn about a nursing organization. And I found the Air and Surface Transport Nursing Organization. And I was like, I can fly in a helicopter and do nursing at the same time? Like, it's phenomenal. That's what I want to do for sure. And
Hmm.
kind of from that moment, it just stuck with me. I thought, that's what I want to do. That sounds so cool. So I started listening to podcasts, anything I could, books, hands-on, whatever I could find about flight nursing is kind of just, I kept that process going. Um, there's a lot of good podcasts out there, and that's where I learned so much that got me to where I am. And then
About flight nursing, there's a
about
lot
flight
of
nursing,
podcasts.
and more so about
Really?
flight medicine. So a
Okay.
couple of them are like Heavy Lies the Helmet is one of them, if anybody's interested. There's a couple
Okay.
of them like MCRIT's one that's more on the doctor side, but it's a lot of deeper concepts in critical care. But those were some of the big ones that really got me into flight nursing. So I'd listen to those, and I'd hear the stories. I'd get to hear the medicine side of it and the logistical aspects, and it hit me and drew me in. So couldn't stop.
Wow. Did you is it like through an agency that you're working? Like how did you get involved? Like is there what would be the process if I was just like I'm quitting the hospital today and I want to become a flight nurse? What is the
Yeah,
what's the process like?
most organizations, most companies, they will say 3 years of either ICU or ER experience, um,
Okay.
and then oftentimes they want you to get your certified flight register nurse within 2 years of being hired. The company that I work for, their typical is 5 years of ER or ICU experience. They want you to typically have a mix of both, or at least some sort of knowledge of both, um, and then the certified flight register nurse on top of that. So that would be your path there. But there's a lot of other things you could do along the way. One of the things that really helped me that I got really lucky to get into was called the Critical Care Transport Academy, and that
Hmm.
is through the the Association of Air Medical Services. And what it is it's a 10-month program that each month is a different section, and the mentors give you a case study, some papers, things to read, And then they say, okay, here's your case study, break it down for us, tell us everything that you would do, give us, from logistics of getting in and out of the helicopter to fuel, like kind of just everything that would go into that case. Put it all out there, write it down, submit it, and then at the end of the month, we all jumped on a call, and there was 33 of us, 10 mentors, and it kind of get broken up into different groups, but we'd all just talk about what we had, and then the mentors would kind of go through and say, hey, here's what you should have done, here's what you did great, kind of worked through so many different things, and in that was aviation, because there's a lot of aspects of aviation that you kind of have to know and get used to. So that to me was probably one of the biggest things that helped me get to my actual flight nursing job. Because once I applied, that actually looked really good on the resume. They said that was something that they liked because they could tell that I had a deeper knowledge than a lot of people as to what actually happens in flight medicine, flight nursing.
Wow.
Yeah.
Wow. That's pretty
So
cool.
if anybody's interested, the Critical Care Transport Academy through the Association of Air Medical Services. It was awesome. I loved it. I would recommend it to anybody. And it's free.
Oh,
so
a real plug.
Yeah, so you have to interview.
Wow, that's amazing. That's great.
Yeah, you have to interview. They only choose 30, somewhere around there. But every year they do the program. So you have to have at least 3 years of nursing experience, or for medics, it's 3 years of like a busy 911 system.
Wow. So now I know you mentioned that like the company that you work for wants you to have like 5 years experience, either mixed like ED and ICU. Were you in the ICU at all, or no?
I was not. So my background is strictly ED.
Okay.
But where my gap got, the bridge to that gap really was in the Critical Care Transport Academy, because they, certain months we had just aspects on cardiology. We went through PA catheters, we went through all the vasopressors, inotropes, just everything that you could think of on that, on the ICU scale of things as well. And they knew our background, so they would push us to really focus on kind of our weak areas. And it, transitioning into a flight nurse, there were still times and some of those really sick ICU transfers that I struggled. It took me a long time to get used to them. My transport bedside times were pretty long, just because I had not dealt with a lot of those things. So many cords, so many pumps and drips, and just managing those. Every time we take a flight with all those, it ends up as spaghetti, and there's not a whole lot you can do about it a lot of the times. But there's just a lot of tricks and things that I've learned along the way from other ICU nurses that would be nice to have, but they're not necessarily necessary if you've got I mean, they would help for sure, but you can also learn them on the job, and if you got the right mindset and the right tools, you can make it work.
Okay. What was your first flight like?
So my first flight, I'll give you my first flight off orientation, because I loved it. My orientation was probably about 3 months long. I worked with another preceptor. Yeah.
Oh, wow.
So it's 3 months.
That's like a med surg orientation, I feel like.
I know. So it's about 35 shifts, 40 shifts, something like that. And you start out just observing everything, and then you kind of work toward doing it all on your own. We do this thing at my company, and probably a lot of companies, that when the weather's bad, we'll do what we call an air by ground. So we will take a car, like a chase car, and go meet the ambulance wherever it is. Typically a hospital. We'll meet up with them, and then we'll go drive with them back to the major trauma center, or wherever that we need to go. That way we can still bring the resources and knowledge that we have to the squad, to the ambulance, but when we can't fly. So I had not done any of those air by grounds on my orientation. So there's a lot of logistics to go into them. You have to transfer all of your equipment out of the helicopter into the back of this car. Make sure you remember everything. So I hadn't done any of those. And we start our shift at 6:30 in the morning, and 7:30 rolls around, and there's some fog because it's morning, it's early, and they call us for an air by ground on my first shift off orientation, which is fine. I was like, all right, whatever. And it was, the first one was a woman on BiPAP. I don't remember all the details, but BiPAP sucks down a ton of oxygen, and you may or may not know that, but on
Mhm.
on an ambulance and on the back of a helicopter, you've got limited amount of oxygen. So you really have to think through. And when you're pushing them in and out of on a stretcher, you've only got a D tank that could only be minutes of oxygen before you get to where you can hook them up to a bigger tank. So you just have to think through a lot of things. So that was challenging. BiPAP is something in the middle that I didn't have a lot of experience with. So thankfully, I had a good partner who had some of that experience. So picked up them. They were not too bad. Then we picked up a STEMI, cardiogenic shock. SATs would never go above 82 on BiPAP. Took
Oh
them to a
my
cath
God.
lab. We transferred her over to the table. She started going into VTAC, in and out. But
Wow.
they took care of it at that point. I think she had a pretty good outcome. And then my last
Okay.
flight was still one of my favorite flights, probably to this day. Flew out to a really rural county hospital. We sometimes we call them scene flights with good lighting because it can be the Wild West in some of these hospitals. And we rolled up, and it was this 30-year-old woman who had a ruptured ectopic pregnancy. And from the second we
Oh,
walked through the door, she was just pale, diaphoretic, like all the classic shock symptoms, right? But we could see it
yeah.
from across the room. And they were giving her blood, but it was going in at like, I don't know, 200 mLs an hour. Nothing that's really gonna do a lot of good for her.
Hmm.
And so I feel like that's when my training, my instincts really just kicked in, and I felt that like flow state. So by this point in time, the weather had cleared. We were able to fly. So we got on the helicopter. We carry, at that point in time, we carried 2 units of whole blood and 2 units of plasma, and a
Hmm.
unit of packed red blood cells. And we gave her everything we had in the cooler. And our flight time was probably 40 minutes, 30 to 40 minutes. But she was just peri-arrest the entire time. We were mixing push dose epinephrine, giving it to her the whole time, calcium, blood, um, everything we could to just keep her awake and alive. And I just felt like I was on cloud nine after that. It's a weird thing, you have these really sick patients and these terrible circumstances, but when they go well and you feel like everything I had trained for all came together, I loved it.
Yeah.
I loved
Yeah.
it. And she had a great outcome. They took her for surgery. She had the rupture ectopic and had 3 liters of fluid in her abdomen.
Wow.
Just like, and then I think she went home 4 days later. Um,
Wow.
those are the stories you love to hear because we do transfer a lot of fairly older people who, their mortality is not fantastic. Um,
Hmm.
so when you transfer these young people and you can really make a difference in their lives and they've got a long life ahead of them, hopefully, it's a special thing.
Yeah.
So that was my first day
Have
off
you?
orientation, and I loved it.
That is the craziest first day ever. I
Yeah.
used to tell people like I would never like during my orientation, like while I was orienting day, I had no rapids, not even like there was no rapids in any nobody else's district. And so that was like
Uh
one of the things I was nervous about because I was like, oh my gosh, what do I do if like
yeah.
and of course shortly after orientation, here I am like I didn't even get bedside report. Like I stood outside the room like, thinking like, all right, I'll be fine. I just so happens to be the first room I go into, and I'm like, did I call a rapid or not? Like I don't even know. Like, and I'm the nurse. Like I don't know what to do. Like it's so
Yeah.
like nerve wracking. And then
It
when you like
is.
finally make it and you like realize like I actually know what I'm doing now. Like I could run this
Yeah.
code. Like it's
Yeah.
it's amazing. Yeah,
It is. It's a cool thing.
yeah. Is there anything that you hate about being a flight nurse?
Ooh,
Loaded
not a
question.
lot. There's not a lot,
Okay.
but I mean, there is risk that comes along with it, right?
Mhm.
A couple of months after I started off orientation, there was actually a medical helicopter that crashed 20 miles from our base. And it was a
Wow.
pilot that actually used to fly with our program. So all of my coworkers, everybody knew him, and it hits so close to home when it's so
Mhm.
close. I mean, they're all terrible when you see it happen, and everybody perished on that flight. Um,
Mhm.
and so there's a lot of risk that comes with it that is tough to swallow sometimes. I feel like over the last year we've had a lot of medical plane crashes.
Yeah, there was one not that long ago in Pennsylvania, I think.
Hmm.
Like it seems so sudden. Like I think from what I remember, like the flight wasn't even like they were like they had just took off or something like that.
Yeah.
And I remember seeing that.
Yeah.
Yeah.
So that inherent risk, that sucks. I wish that were different. I wish, as an industry, aviation is fairly safe. For some reason, medical aviation is a little bit worse off than regular aviation. And granted, we're going to scenes, like we're going and landing in fields and parking lots and places, as well as like different helipads on hospitals. So there's a lot of risk because you're flying around telephone wires, you're flying around trees and big antenna, and so there's a lot more that you got to pay attention to and do. And human factors play a big role in that. So fatigue, just things that are going on in your life can really affect how aware you are of those things. So that risk is something that I wish were different, but it is a risk that I accept every day. One of my pilots, they say, through his training to become a helicopter pilot, one of his early mentors gave him this piece of advice and said, "The helicopter is a spiteful bastard that's always trying to kill you." And so, and he's like, if you can always just remember that, then you'll be looking out for wires, you'll be looking out for trees. Like, you'll just be more aware, because when you get complacent that those accidents start to happen.
Okay.
So that risk is tough. It's there. Another thing that I struggle with is the pay. The pay is not great.
Really? I thought I
Um,
don't know why in my head like that was gonna be one of the questions I asked you, but I honestly thought that I'm like since you're more at risk, than any other type of nursing that I think of, maybe psych, I think is the only other thing I could think of off the top of my head that would be like
mhm.
super dangerous. Like I don't know why I thought like this would be like the cream of the crop pay.
Nope.
Now, does it you think do you think it has
um,
anything to do with location or it's like across the
that
board
definitely
it's just
plays.
not
That
good?
100% plays a factor, but I think generally, flight nursing is pretty underpaid. And I'm new to this, right? So this is still all my year and a half of flight nursing. So there's things I may be getting wrong in this, but flight nursing, along with paramedics, ambulances, is considered transport and not actually critical care medicine. So you can't bill
Wow.
the same way to like Medicare, Medicaid, things of that nature, because it's just considered transport. It's not considered medical care. And
Wow.
other things that you can do in that change billing. Giving oxygen is one of the examples, but it's only up to a certain point. So I think that aspect really has hindered what paramedics make, EMTs, and flight nursing, anybody pre-hospital, because it's just a transport. They're not
Mm,
going to be able to get reimbursed in the same way as somebody in the hospital or surgery or things like that. Um,
gotcha.
so that's one factor. But there are some places that pay decent, but I still think they're not up to the risk that we take on, the procedures that we can do. We can intubate, we can do pericardiocentesis, we can do finger
Oh,
thoracostomies.
really?
Carry a whole slew of medications that we get to decide when to give,
Mhm.
based on protocols. But still, it's just me and one other partner that we get to make those decisions. So there is a lot of care that we provide that just I don't feel like that we're compensated for well.
Thanks for listening to another episode of The Nurse Aspect, where we assess and evaluate. Keep it locked in next week for part two.